So today I wanted to talk to you all about a blowout kit, or some people call it an ifak. ifak stands for individual first aid kit. So we've been going to the range about every other week. Maybe a month or so ago, we had an incident where somebody there got slide bite. Not anybody that I was supervising, but a bad case of slide bite. If you don't know what that is, it resulted in a nice size cut here. And I was lucky that I had my ifak with me and I was able to help at that point. So, blowout kit, ifak, I'll use the terms interchangeably here. But basically, anytime I go to the range, I have one with me. I make sure that the people who are around me know where it is. Now, if you have kit or gear on, you should have an ifak on your person. And a lot of times people wear them not where they can reach them. And, what people don't understand, they're like, well, if somebody gets hurt and you have to reach it and it's way back there. No, your ifak, your blowout kit is for you. So if you get hurt and someone comes up to help you, your kit is already on you. So what you're supposed to do is let people know, hey, the people around you, this is where my kit is. So that they know you get hurt, they can grab that kit. So we're gonna go into this kit and see what's in here. Now, some of these things that we're going to talk about absolutely need to be expanded upon by a medical professional. I'm not a medical professional. I've taken some classes, I've taken some courses in these things, but I'm not a medical professional. So when we want to really learn about them, I'm going to have some people come on and have conversations with us and instruct us on how to put on a tourniquet, for instance, how to deal with a tension pneumothorax. So let's go into the blowout kit. So it is for massive trauma, bullet wounds, knife wounds, car wreck, anything that's causing uncontrolled bleeding. In fact, if you haven't seen, a lot of places have what they call a stop the bleed class. And in the stop the bleed classes, they go deep into these. So I'm just gonna go into what's in mine. This is an emergency bandage. I prefer the Israeli bandages. I've had to use them at work before. They work great, and we can go one day into how to set those. This is not an Israeli bandage, but it is an emergency bandage, and we'll do a demo of this as well. So it's a 4-inch hemorrhage control bandage. So that's the first thing we're going to pull out. Now, another roll of dressing, gauze, and again, we're trying to stop the bleed, so absolutely need that. Gloves, of course, I have 2 pair in here, 2 pair of gloves. And when we had the incident at the range, that was the first thing I did, put on my gloves. We're living in a world of COVID. I would put on my gloves even without the world of COVID. But you want to make sure that you're keeping yourself safe, you're keeping other people safe when you're rendering aid to people. So I made sure that I have gloves. Now, this is a chest seal. So why would you need a chest seal? So one of the main ways that people die during massive trauma is what they call a tension pneumothorax. A tension pneumothorax, basically, if you get in your chest area, if you get a puncture wound in your chest area, it can cause air to enter your chest area. Now your lungs expand and contract. So every time your lungs contract, it sucks air in. As your lungs expand, they can't fully expand. And so every time you breathe out, and your lungs get more and more contracted until you basically suffocate. So what you need to do with that, I have a chest seal, but a tension pneumothorax is really something that you can get a piece of plastic, you can get a piece of tape, and again, we'll have a medical professional come on and have those conversations with you. But, it's also important just to let you all know what it is right now. So that's a chest seal. The other thing dealing with the tension pneumothorax would be, and this you absolutely would need some medical instruction on, a 14 gauge needle. And I'm not even going to go into how to use that or why, because I do want a medical professional to have that conversation. In fact, I would prefer you take a class. Take a class, really learn how to use it. You should, at the very least, have taken a basic first aid course. After a basic first aid course, you want to take stop the bleed and things like that. But you absolutely need that for the safety of yourself and your family. It's imperative. So shears. Shears so that if someone has an injury, you can cut those clothes off. You don't have to try to wiggle somebody out. You just take these shears, cut it off, and get to the problem right away. Now, hemostatic granules. This is silox. So you want some way, if someone has a wound, they're bleeding massively, this would be, beside the gauze, another way to stop the bleeding. And these granules you would pour in there. A lot of people really don't like them because when you get to a doctor, they actually have to clean that out. In my understanding, and I've never had these poured into a wound, is that it does not feel good. But if someone's about to bleed out, you know, you do what you have to do. Now, nasal pharyngeal airway. So in order to insert this, you do need some sort of lubrication because this airway goes into the nose and down. So you would have to have some Vaseline something to let it go. Very uncomfortable. But when you're saving someone's life, we're not talking about comfort. Tape, of course, waterproof tape. Now, the other two things I have is an all-weather notebook and a Sharpie. Sometimes you may have to write on the person what's going on so that people who come after you can know. Sometimes you may have to make a note and tape it to the person. Either way, you know, communication is key, and this is how you can communicate if someone's injured to the people down the line who are treating them. Now, I saved this for last. This is a rat tourniquet. I've heard a lot of different things about them. I have a few different types of tourniquets. This is the one I have in here because it's small, and we are going to have someone come and show us exactly the best way to use a tourniquet. But a tourniquet is for, again, massive bleeding, especially on, you know, your arms, legs, places like that where you can put a tourniquet on. And I'm not going to go into how to do it right now because I absolutely want to have someone come on who's an expert and who can show y'all correctly. I don't want to give you bad information. So there we go. That is what's in my blowout kit / ifak. If you have any questions, concerns, let me know. If you'd like to come on and you're an expert and you want to demonstrate any of these, but I do have some people in mind. So, you know, again, I'm willing to answer all your questions. Let me know if you have any. Thank you.